Good morning, everyone. Good morning, everyone. Can we rise up for the national anthem as we start today's event?
Mr. Albert Congo raises the flag of the new nation.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed.
Can I indulge you and ask you to put your hands together for Nigeria? And you can have your seat. That's such a powerful anthem. Such a powerful anthem. Good morning, everyone. It's great to see you all here for the SayAMR Language Hackathon. This is not just another event, it's a special gathering because what's happening here over the period or the duration of the hackathon is at the heart of Nigeria's public health story. We are here thanks to the powerful partnership between the Nigeria Center for Disease Control and Prevention, DRASA Health Trust, SayCAPS at the University of Lagos, and the Committee of Vice Chancellors of Nigerian Universities. Can we put our hands together for this solid partnership? And together they are driving Nigeria's national response to antimicrobial resistance, which is one of the biggest health threats in the world right now. Now, AMR sounds like a heavy scientific term, and it is. But here's the thing. For many people, it's not that they don't care about it, but they just don't understand it. And because the language of science doesn't always speak the language of the people. And this is exactly why we're here. This hackathon is about finding the right words in our own Nigerian languages that help everyone understand what AMR really means and why it matters. And when that happens, something powerful shifts. Awareness spreads faster. People take action and communities respond. So, as we brainstorm, translate, debate and create in the different hackathon communities, we must remember one thing. We're not playing with words. We are shaping understanding. We're giving life to ideas that will literally save lives. And so on behalf of NCDC, DRASA, and all our partners, I'd like to welcome you once again to the SayAMR Language Hackathon. Please, one more time, a round of applause for the conveners of this meeting. Now, before we go ahead, I want us to carry out a quick icebreaker just to calm our nerves and, make the atmosphere more relaxed. So let's try something quick. I'd like everyone right now to think of how you can say the word health in your local dialect. Think about it now. What's the word health in your local dialect? Don't say it out. Have you gotten it? If you have gotten it, can I see your hands? You've secured the word. I want to have everyone's full participation. Have you thought of the word health in your local dialect? All right, on my cue, we'll shout it out together. I'll count 1 to 3, and everyone just shout it out. Are you ready? We don't sound like we're ready. Are you ready? On the count of 3, you shout out health in your local dialect. 1, 2, 3. We'll try that again. 1, 2, 3. Now, what you have heard, that's inclusion. And by the end of this hackathon, we would have words like this also too for AMR. And that's why we're gathered here. That's the essence of this, this gathering. So one last thing that I would like us to do. Find someone near you and tell them one word you wish Nigerians use more when we talk about health. Look at someone near you, think about it, and what is one word you think Nigerians should use more when it comes to health? And just tell them. This is participatory. So what is that one word that you wish Nigerians use more when they talk about health? All right, I can see smiling faces. I'm hoping someone leaves here with a new word, in their mind. All right, thank you very much for participating in that. The next thing on the agenda is to bring up for her opening remark the Managing Director of Drasa Health Trust, in person of Mrs. Niniola Williams. She leads the organization, which is a non-profit dedicated to building a healthier and safer Nigeria through health security, infection prevention, and community education. With a strong background in development and health advocacy, she is passionate about empowering communities and young people to take active roles in promoting hygiene, preventing infections, and combating antimicrobial resistance. Niniola's leadership at DRASA has positioned the organization as a trusted partner in national and global health efforts. Distinguished ladies and gentlemen, with a round of applause, can we please welcome the Managing Director, DRASA Health Trust, Mrs. Niniola Williams. Please keep clapping as she comes. Don't stop clapping. Thank you.
Good morning to everyone. Distinguished ladies and gentlemen, esteemed partners and innovators in the room, you are all welcome to the launch of the SayAMR Hackathon. This is an initiative that is bringing together science, creativity, and community to confront one of the most pressing health challenges of our time, antimicrobial resistance. Let me begin by acknowledging our partners, the Nigeria Center for Disease Control and Prevention, the Committee of Vice Chancellors of Nigerian Universities, the Center of Infection Control and Patient Safety, and all others who have joined hands with us to confront what is a huge challenge globally. Thank you for making this collaboration possible. Across Nigeria, infections remain a challenge. They disrupt lives, they put pressure on our health system, and they can be prevented. Whether in our hospitals, in our communities, or in our schools, these preventable infections remind us of the importance of awareness and strong systems of care. At DRASA, we believe that these infections are indeed preventable. And our work continues the legacy of the late Dr. Adadevo, whose decisive action during Ebola saved millions. We believe that her courage, her service, and prevention can be translated to develop a network of health champions across Nigeria. People who are everyday citizens, health workers, students, artisans, religious and traditional leaders, who are boldly acting to protect health, prevent infections, and strengthen community resilience. But to activate these people, they need to be educated, they need to be made aware, and they need to be engaged. This hackathon is an extension of our vision collectively with all of our partners. It recognizes that prevention is not just about medicine or policy, it's about language. How we speak about AMR determines how people will understand it, and also how they will act. And in a country of, as Professor Haruna was just speaking to me about, linguistically rich as Nigeria, we have more than 500 spoken languages. So our words have to reach every home, every market, every school, and every classroom. Through this hackathon, we are reimagining how to communicate science in words and expressions that resonate with the people in our communities. We're combining creativity and innovation with storytelling and public health. To all the young innovators, creators, and health advocates who are going to participate in this hackathon, your ideas can change how Nigeria speaks about AMR. You have the power to make it real, to make it relatable, and to make it actionable. Because the way we talk about AMR will shape how we fight it. So together, we invite you to join us with our partners so that we can build a Nigeria where every person, regardless of their language or their location, is part of the movement to stop AMR. Thank you, and you're welcome.
Please, another round of applause for the Managing Director. All right, up next on the agenda is the keynote address on AMR. And this keynote address is going to be delivered by an important person amongst us here, someone who leads the charge at one of the topmost public health institutes out of Africa. He's the Director General of the Nigeria Center for Disease Control and Prevention, NCDC, with decades of experience in health system strengthening and disease prevention. He has been instrumental in driving Nigeria's response to infectious diseases and public health emergencies. Under his leadership, the NCDC continues to champion initiatives that promote antimicrobial stewardship, strengthen surveillance, and build national resilience against health threats such as AMR. Distinguished ladies and gentlemen, if you would indulge me, can you rise up on your feet as we welcome the Director General, Nigeria Center for Disease Control and Prevention, in person of Dr. Jide Idris, with a round of applause. Please keep clapping as he walks up stage.
I don't see why people should stand up for me. But let me say that it's a pleasure being here. I also say again that, we learn every day. There are some things I've learned within the short period I've been here. I wish I was a professor like Professor Haruna, but I don't have the knowledge yet. I'm supposed to give a keynote address for this event. Before I do that, I need to say one or two things also related to this. I was just having the discussion with Professor Haruna when he was talking about language and science. The short period I sat with him was a period of lesson to me. And like I did tell him, we in the healthcare profession, we think we know it all. We don't. And we cannot effectively work if we don't communicate with people. 2 weeks ago, after that Ebola scare, discussion with one of the TV presenters, he said he was going to arrange a course in communications. And I told him, NCC will be interested. Because do here, disease prevention and control, communication is key. And we need to work with people who have the wherewithal, who have the knowledge on how to communicate, or else whatever we do will be for naught. Right now, in NCDC, we are managing about 10 outbreaks in the country. That's the truth. Interesting in that in the next couple of days or weeks, in fact, days, within this month, we're going to start the beginning of Lassa fever, followed by meningitis. These two events are killing people, killing Nigerians. Over communicating, progress has been slow in bringing it down. It's the essence of communication. The last bit, I look around the hall here, I see the youth. And there is nothing we can do, emergency preparedness response, without involvement of the youth. Because you constitute the largest proportion of our population. That's one. And they say again, like most people. So the earlier we got involved with you, the better. And finally, before I read this speech, everybody talks about AMR. Very few people understand what AMR is. And to me, it's a complex issue. But unfortunately and quietly, killing more people than we realize. So the earlier we started getting the acts together on this, the better. So after this event, we are going to engage more with the youth over this issue, not only on AMR, on every single thing we are doing. So I think today is just the starting point. And like the speech they gave me to read, I agree with the speech. Let me tell you, if I don't agree, I won't read it. Distinguished guests, partners, innovators, young change makers. It is a privilege to deliver this address at the launch of the SayAMR Language Hackathon. Let me begin by commending Drasa Health Trust. You know, interesting thing, you don't even know my relationship with Iniola. I met her for the first time in life in DC at a conference shortly after Ebola. And interestingly, Ameyo was my classmate in medical school. The Committee of Vice Chancellors of Nigerian Universities, Professor Haruna here, like I said, I learned a lot within the short period I stayed with him. I'm going to be in touch with him after this. And all our partners who have worked tirelessly with us to bring this bold and visionary initiative to life. Antimicrobial resistance is one of the greatest health and development challenges of our time. It threatens the foundation of modern medicine, and the safety of our future. For Nigeria, AMR is not just a health issue, it is a matter of health security, food safety, and economic stability. It affects our ability to treat common infections, protect our livestock and crops, and sustain livelihoods. This is why the Nigerian government has taken the decisive action through the National Action Plan on AMR 2, spanning 2024 to 2028, a plan that reflects our national commitment to a One Health, multi-sectoral, and evidence-driven approach. The plan emphasizes prevention, stewardship, and the power of communication in changing how Nigerians understand and respond to this invisible threat. This hackathon, SayAMR, highlights the power of language in public health and embodies that vision. Because what we cannot say, we cannot fight. Nigeria is home to more than 500 languages. Each language carries not only words, but wisdom, ways of knowing, feeling, and connecting. When we communicate health messages in people's own languages, we move from awareness to ownership. Research has shown that language is not a mere vehicle for communication. It is a vessel of understanding and action. In Nigeria's early HIV/AIDS response, for example, the absence of local words for the disease fostered fear, stigma, and silence. Not only HIV/AIDS, even Ebola and COVID. But once communities developed their own expressions, words that reflected their lived experiences, the narrative shifted from fear to empowerment. The disease became something people could talk about, understand, and act against. Similarly, in studies with African women on menstrual pain, dysmenorrhea, using local language helped women express their experiences to seek care and engage with healthcare providers more effectively. These examples remind us that language saves lives because when people can name a problem, they can begin to solve it. The SayAMR Hackathon matters because it challenges us to bring AMR home and to make it relatable, memorable, and actionable in every Nigerian community. Through this initiative, we are inviting young Nigerian linguists, both students and faculty, communicators, health professionals, artists, and innovators to help us give AMR a local voice. To find the words, the metaphors, and expressions that capture its danger and inspire action. This initiative is transformational as we are taking science out of the laboratory and putting it into the language of the marketplace, the classroom, the farm, radio, and the song. When a market woman in Aba or a herder in Katsina can describe AMR in their own words, when it becomes part of conversation and culture, then we have truly begun to win the fight. AMR is a silent pandemic and a shared responsibility that requires every voice. No sector, profession, or person is exempt. That is why Nigeria's response follows the One Health approach, uniting human, animal, and environmental health. It is why we are expanding AMR awareness through schools, community dialogues, and youth engagement initiatives. And that is why SayAMR is timely and strategic. It places youth, our university students, at the center of change, the digital generation that can make AMR trend in new ways. It connects innovation with inclusion, ensuring that messages about antibiotic misuse, hygiene, and prevention are accessible to everyone and everywhere. The SayAMR initiative is a blending of science, art, and language to reach the hearts and minds. It is a reminder that the fight against AMR will not be won only in the laboratories and policy meetings, but also in the communities, the homes, and within our conversations. When a mother knows not to demand antibiotics unnecessarily, when a farmer understands why drug residue matters, when a student can explain resistance in Pidgin or Hausa or Yoruba, that is progress and the further strengthening of our health security. Let me again thank DRASA Head Thrust, the Committee of Vice Chancellors of the Nigerian Universities, our international partners including WHO, FAO, WOH, UNEP, and all One Health stakeholders for their unwavering support. To our young people and faculty participating in this hackathon, I challenge you to unleash your creativity. Help us to find words that will inspire a generation, bridge science and culture, and protect our collective future. Let us make AMR speak our languages, and let us speak Hausa, Yoruba, Igbo, Pidgin, Tib, Kanuri, Efik, and many more. Because when we can say AMR, we can stop AMR. Thank you very much.
Please, another round of applause for the DGN CDC. Very powerful and impactful keynote right there. When we can say AMR, we can stop AMR. Some other thing that stood out to me from your keynote is when you said when we communicate AMR in local languages, we go from awareness to ownership, and that's such a powerful thing to take note of. Thank you so much, sir. Before we go further, let me take a moment to quickly introduce myself. I think I forgot to do that. My name is Tijes Wojumu, and I have the honor of serving you as the Master of Ceremony for this groundbreaking hackathon. I wear many hats in my everyday work. I help to tell stories that connect people, ideas, and impact. But today, my role is simple. It's to hold the space for each and every one of you incredible minds in this place. And I'm deeply inspired by what this event represents. So I would like us to move to the next thing on the agenda, which is the goodwill messages from partners present here. Now, to bring us the first goodwill message is none other than the Secretary General of the Committee of Vice Chancellors of Nigerian Universities. Can we put our hands together as we welcome Professor Andrew Haruna? We're going to be clapping a lot today, so I'd like us to prepare our minds. Let's put our hands together as we welcome Prof.
Thank you, sir. Good morning, all. I have already been introduced, but unfortunately, as a teacher, I'm not a man of protocols. So I acknowledge the organizers and our director, who gave us a wonderful speech. The rest, you are the most important people here. For those of us who are over 60, you see we're already quarter to go. So those of you who are here is the future of this entire program. But before I give my goodwill message, let me say one or two things. I took the liberty to speak to the coordinator and our director. I shared with the last speaker, fortunately, by the grace of God, I happen to be the president of the Nigerian Academy of Letters. So all the humanities, I'm with them. And my colleague in the Academy of Science, we've been talking about education and how we can communicate to our Nigerian populace. Fortunately, I'm a linguist. So I immediately impose, since you are talking about science, medicine, and language, you also got to understand what you are talking about. So we engaged the current Minister of Health and invited him in the Academy of Letters. I said, you are a wonderful medical practitioner, and you have wonderful programs from abroad. And you want the Nigerian population to really get to understand all this campaign about Ebola, about AIDS, about malaria, about whatever. But to us, in the arts and humanities, it's like the language of the deaf. Just like the missionaries came, they preach in the Bible. How many of us can dream dreams in our local languages now? Can you dream dreams in your local languages? How many of us can effectively pray and talk to God in their own languages? So you see, linguistically we are something else. But we are Nigerians and we belong to our local communities. So the language of science is far removed from our heart. It has just become a mental vocabulary. So as long as you don't communicate science or all that you are doing, excuse me, I had some little cold, with the language of the heart, you are not getting anywhere. You are not getting anywhere. If you talk about education, a small Fulani boy who tenders cattle, 100 heads of cattle, before the age of 10, when you put him into primary school, you start teaching him in a language which is not his own mother tongue. The knowledge of 10 years has gone down the drain. He knows every bit of plant, medicinal plants, how to take care of his environment in the language with which he speaks. Now you put him in school, you start teaching him vocabularies which were far removed from his own socialization. So I stop at this point. But just to tell you, we spend billions of money in trying to communicate simple science, but we are not getting anywhere. We just end up just having a fun fair. I promised to send the director the wonderful speech by the current Minister of Health when we invited him to the academy to blend his scientific knowledge as a medical practitioner and how science and language and the humanities connect. And that speech is good to give to these young people to read it because the minister spoke in the language which was just very simple. So I stop at that. It's not a lecture, it's a goodwill message. But to look at the complication which you have, whatever you do, this is Nigeria with over 500 different languages. If you talk about the North uses Hausa language as a lingua franca, but this is northern Nigeria. You see from here? You see here? Benue, Igala, you see here, Tiv. All this is what you call northern Nigeria. And there are over 360 different languages. So if you talk of Hausa, where you communicate effectively with Hausa, you are speaking to only these states, the 5. Here is Bagi, Kambari, Nupe, Ibo, Dibo, Obara, Chile, Tiv, you know, all of them. You come to Borno, it's Kanuri, Bura, Bole, Bade in Yobe. In Adamawa, there are over 60 different languages. So Fulfulde is just one. So whenever you are talking about whatever you do, even if it is the tablet of malaria, almost 300 universities in Nigeria. Almost 300 universities in Nigeria. Scattered across. So even if you use English, you can now see effectively where some can be deployed. So even in the educational structure, the setup, the orientation of the country as regard to even the modern education, even with university education, this speaks a lot and it speaks volume. I stop at that, then I just give you my goodwill message and I sit down. Thank you. I want to thank Drasa Health Trust, the Nigeria Center for Disease Control and Prevention, for inviting me to come here. So I acknowledge this with profound gratitude. I want to greet our colleagues, our friends, the press, and all of you who have come here. So on behalf of the Committee of Vice Chancellors of Nigerian Universities, I am pleased to express our full support for the SayAMR language program here. This initiative is a brilliant example of how innovation, academia, and public health can come together to address a global challenge. By translating MR concepts into our indigenous languages, this project ensures that vital health information becomes understandable and actionable for all Nigerians. It is a powerful reminder that language is not just communication. We have heard it from the DG. It is a connection also of culture and empowerment. Anyone who loses his language, he has already lost his identity. And all of us care about languages. And even in unifying Nigeria, Nigerians are Nigerians in skin, but many have lost their languages. They could be Yoruba, but you discover that they don't even speak a single word of Yoruba. They have become linguistically something else. In the northern part of Nigeria, many speak Hausa, but linguistically they are not Hausas. They are something else. And when you speak Hausa in political campaigns, sometimes you use terminologies that attacks the sensitivity of people. So even the unity of Nigeria, if you don't use the correct language, you insult and create problem. I took a study of over 70 different languages within Nigeria. All of them have terrible words against one another. And the children are raised and socialized with this right from home about that community. So there is no way you can have unity if right from home they have been socialized with the negative terminology against the next door neighbor. So even the unity of Nigeria cannot be effective enough. It has already been compromised right from creating dictionaries, translating them into the local languages. I will supply all this information and NCDC for this visionary initiative. I reaffirm our commitment to working together to build healthier, more informed communities through education and collaboration. And why I insist that we need to get used to the universities, even to primary to secondary schools. Without education, we cannot go anywhere. For those of you who are young people, I admire your courage. I admire your own zeal to team up with this. Pursue education in whichever discipline. I will conclude by giving you a short story. You see me standing here. The difference between Andrew Haruna and the boys collecting bottles by the roadside is just because I went to school. Okay, I started my life as a shoe shiner. I was collecting bottles by the roadside. I clean shoes. So, but I have the privilege to be in school because my parents could not pay my school fees. I paid my school fees with shoe shining money. If you Google in the internet, you read the story. So I want to encourage you as you continue with this as young men and women. Don't give hope. Don't lose hope about our nation and the health of our people. It is only when the nation is healthy that we can get somewhere else. I congratulate you, the organizers, but I'm sure next time you will not invite me because I have turned the goodwill into a lecture. God bless you. Thank you.
Thank you so much, Prof. Sir. You can't have a professor come to speak to you and, you will not be immersed in the knowledge of what he's sharing. But at least we thank God that we have not gone through up to 50 slides. Just 2 slides. Thank you so much, sir. We greatly appreciate you. All right, up next to give us his own goodwill message is none other than the technical officer, AMR, and One Health coordinator with the World Health Organization in person of Dr. Shavan Laxmikant. Can we put our hands together as we welcome him on stage?
Good morning to all of you. I was not really prepared for the speech, but first of all, allow me to stand on the existing protocol, and on behalf of our new WHO representative and the head of the mission, Dr. Pavel Urso, who just joined recently. I really appreciate DRASA, NCDC for really inviting us. Really thank you for this, a very different and innovative idea of language hackathon. I was trying to see what is this language hackathon, but I think this is something really a need of an hour. Why I'm saying that, when I was working in India, as you know, there are 1,600 languages. Professor just mentioned Nigeria is same like India. We have 22 official languages in India. So it is more or less same. It's the same structure. So when we were doing our, I was working in HIV, and we were doing a study and this bio-behavioral study. So we observed that English will not really work everywhere. When you go to the community, you really need to inform them what is HIV, how is it transmitted. Same way, I think we are trying to achieve here that, and I see that there are so many communities and they speak in different languages. So it is really important. We need to reach to that each and every person, not only just journalists or media people, or policymakers and the students, but also in the community who are there, because AMR is everybody's responsibility. And AMR doesn't respect the borders. It can go from one place to another very easily. So I think with this, everybody's responsibility, this Pidgin and Hausa and Igbo and Yoruba languages, I am sure we will have those creative and very effective messages which will be translated from English to really into that languages, and everybody will understand that what is AMR, how it is spread, and why that community person is really important to understand AMR. Because most of our driving or risk factors for AMR starts from the community. They actually ask, please give me antibiotic. They go to the pharmacist and they ask, please give us antibiotic. They ask doctors. So it actually starts there. How you can rationalize, this antibiotic use. And this antibiotic use and misuse is a big issue in Nigeria. So to actually address, this is one of the best and innovative idea. And so I thanks DRASA and the team who is really working behind this, the language hackathon. When I was speaking with my maid, I really told her, you know what is AMR? She is in Hausa. She said, I don't know what is this. But I said, I will come today and tell you. I will learn some words from this hackathon in Hausa, how to speak this. So maybe that is something. And it's really interesting. They will actually continue to ask you, okay, how is AMR and how I should know it. What is my role in this? So I think at the end of this hackathon and all those, we will be able to address how this AMR is important for each and everybody, every vulnerable population, why it is important for him to understand AMR. Because in Nigeria, we know that more than 60,000 people are every year dying from AMR. And as DG said, it is a silent pandemic. And it's pandemic means it's already an evolving, ongoing pandemic. It's not that we are waiting for a pandemic to come like COVID and all those. It's already happening. So I think this is the right time. We really need to act now. And this is something is really happening. I'm really thankful to all the stakeholders here, and as a WHO, and on behalf of our 3 levels of WHO and also quadripartite, I think we really join the hands with our DRASA and the NCDC team to make this initiative innovative, impactful, and really socially acceptable and culturally acceptable. And my best wishes to all of you. Thank you so much.
Thank you very much, Dr. Shaban. And I really hope that you get that Hausa interpretation of AMR before you go. All right, to give us the next goodwill message, I'd like to bring up on stage the Executive Director at Shefini Consulting. And that is in person of Dr. Ayodele Majakodumi. Can we put our hands together as we receive the Executive Director at Shefini Consulting?
Good morning, good afternoon, everyone. Permission to stand on the existing protocol. It's a real pleasure to be here today at this AMR Language Hackathon because, as the previous speakers have mentioned, communicating science, communicating health messaging is always tough. But communicating AMR is particularly difficult because even in English, how do you communicate clearly and effectively what this silent problem of AMR is? And so it's a tough assignment even in one's first language, even in one's native language. And as we've heard from the professor, for many of us, our native languages may no longer be our first languages. We may think in one language and mostly speak another. Many of us are multilingual. The situation is not as straightforward as it once was. And so it is imperative that we make every effort, one, to continue to simplify and clarify the message of AMR, and two, to ensure that we do this in the language, but also in the terms that people understand. So it must be relatable. It must be clearly understood. People need to be able to see themselves in whatever messaging or explanation you are giving, and they must understand what is being recommended and what is not. They must also have a clear understanding of what the consequences are of sticking to the recommended behaviors or actions and what the consequences are when we go outside of that. Shefini Consulting is active in the AMR space in Nigeria. We're really, really pleased to be here to congratulate DRASA and the Nigeria Center for Disease Control on this event. And we are very happy to continue to support this in any way we can. And I also want to particularly thank the organizers for the focus on youth. Because really the youth are the most important. Whatever innovations, whatever messages we are able to pass on to the youth, those are the things that will continue to have impact for many years to come. So working with youth, making sure that youth are involved in what we do is a gift that will keep on giving. So once again, we are very happy to be here, and we look forward with interest to the outcome of this activity. Thank you all.
Thank you very much to the Executive Director of Shefini Consulting. All right, to give us the next goodwill message, I'd like to welcome on stage the Project Lead Infection Prevention and Control at the Institute of Human Virology, Nigeria, in person of Chidima Ibe. Can we welcome Ms. Chidima Ibe with a round of applause? You're welcome.
Good afternoon, everyone. Please allow me to stand on existing protocol I bring you greetings from the International Research Center of Excellence of the Institute of Human Virology, IHVN, to the launch of the SayAMR Language Hackathon. This hackathon is both creative and a strategic step towards bridging the language gaps, which most often limits understanding and, of course, action to antimicrobial resistance. So by translating complex AMR concepts into Nigerian indigenous languages, we believe that it not just fosters inclusion of the grassroots, but also strengthens their understanding and response to AMR. So as an organization that's deeply committed to strengthening infection prevention and control, we recognize the importance of effective communication and community engagement in strengthening AMR response in Nigeria. Some 2 years ago, together with the NCDC, we adapted what the WHO patient information leaflet on hand hygiene into Hausa language. So this was to encourage, more understanding amongst our patients, and we actually found that we found more patient engagement. There was more understanding of hand hygiene, unlike when we just go about, in English, educating those patients. So the project was domiciled in North Central region. So we translated the information on those leaflets to Hausa language, and we were happy with the engagement and understanding we got from those patients. So we want to commend Drasa Health Trust, NCDC, CCABS, and the Committee of Vice Chancellors in Nigerian universities for their vision in driving this forward-thinking initiative. And we look forward to the impact of this initiative in strengthening communities and also supporting the Nigerian AMR response. Thank you.
Thank you very much for that goodwill message. We will take one more goodwill message, after which we'll go to the framing of the session while we're here. But before we take the goodwill message, I'd like to acknowledge here present the leadership team of the Nigeria Center for Disease Control. Those are the people that make the organization function the way it does. Those are the people who contribute to the excellent work that we read of, for the people who keep us safe from infectious diseases. So I'm just going to call the names of the directors, and as I call them, please, you just applaud. I'd like to recognize here present the Director of Special Duties in person of Dr. John Oladejo. Can we put our hands together? Also, I'd like to recognize the Director in Special Duties, Mr. Sebastian Yenan. Can we put a round of applause, please? I'd also like to acknowledge the presence of the Director in Special Duties also too, in person of Dr. Kemi Ladeinde. Celebrating. I'd like to also acknowledge the Director, Department of Planning, Research and Statistics, in person of Dr. Sikiru Badaru. I'd also like to acknowledge the Director in Department of Planning, Research and Statistics, in person of Dr. Ladun Okoromade. I'd also like to acknowledge the presence of the Director of Subnational Support, in person of Pharmacist Chibuzo Ene. And I'd also like to acknowledge the presence of the Director of Public Health Laboratory Services, in person of Mrs. Olajumoke Babatunde. And last but not the least, is the Head of Department Disease Prevention and Health Promotion, in person of Dr. Tochi Okwo. Thank you very much for your partnership with DRASA and for the work that you do. All right, to give us the last goodwill message, I'd like to bring up the Alumni Engagement Officer, AMR InterVarsity Training Program, in person of Adeyeye Blessing. Please, a round of applause for Adeyeye Blessing.
Good afternoon, everyone. Permit me to stand on the existing protocols. And as introduced earlier, my name is Adeyeye Blessing, the Alumni Engagement Officer for AMR InterVarsity Training Program. Here today, I'll be representing AMR InterVarsity Training Program and the co-leads in the person of Pharmacist Kenneth and Mr. Adamu. Permit me to also use this avenue to commend the great work that has been put into this initiative by Nigeria Center for Disease Control and Prevention, the Drasa Health Trust, and every other collaborators who has contributed to the success of this great initiative. I think we need to commend them for something as great as this. So the SayAMR Language Hackathon is a very good initiative, and I believe it does not only promote youth inclusivity, it will also help to mitigate the gap in language as regard AMR mitigation in Nigeria. And I believe this will go a long way in solving AMR in Nigeria. Also, I want to pledge our full support from AMR InterVarsity Training Program community. We will support this initiative in every way we could with 35 AMR clubs we have all over the universities in Nigeria. We'll make sure there's good communication of the initiative to them, and I believe they will participate in the hackathon. Once again, thank you all for having me here.
I'd like us to put our hands together again for that commitment. Thank you very much. All right, moving on, the next segment on the agenda is framing the conversation, and I strongly believe it's an opportunity for us to listen to the global context and national context around what we're doing here today. And the person who will lead us in this segment of today's agenda is someone who I've known who is highly passionate about AMR. If you are going to talk about the story of AMR in Nigeria, it will not be complete without talking about the work that she has done in the past few years or more. She is a public health physician and the head of the Disease Prevention and Health Promotion Department at the Nigeria Center for Disease Control and Prevention. She also leads Nigeria's National Antimicrobial Resistance Program, coordinating efforts to strengthen infection prevention, surveillance, and responsible antibiotic use across the country. She has a deep passion for behavioral change and public health advocacy, and she continues to inspire collaboration and innovation in Nigeria's ongoing fight against antimicrobial resistance. Ladies and gentlemen, with a round of applause, welcome with me the Head Disease Prevention and Health Promotion, NCDC, in person of Dr. Tochi Okwo.
Thank you. The DG NCDC, distinguished colleagues, good afternoon. Please permit me to stand on the already established protocol. I'm standing here today to paint the picture, describe the need, and attempt to help us understand why we felt the need to describe AMR in Nigerian languages. So as the DG and everybody that has spoken here has made very clear, AMR is a profound challenge, but it is as much a problem of science as it is a problem that has to do with language, has to do with culture, and also has to do with how we communicate in the health sector. And for us at the NCDC, and NCDC coordinates the national response and control efforts, the question we have had to grapple with is, how do we raise awareness about a threat that our people do not even have the words to describe? And when we think about AMR, the science of it, the pathology of it, and the consequences that it has, the numbers, and I won't read out any statistics here, but an interpretation and breaking down of the numbers paints for us a very not so good picture. It shows us what is happening in our hospitals, how the gains we have made in the health sector over the years can be unraveled by the problem of antimicrobial resistance. It will mean that surgeries are becoming more dangerous. Cancer patients, their chances of surviving, in spite of improving oncological care, is becoming compromised. Children in neonatal ICUs, in spite of the best efforts of neonatologists, may be unraveled by infections that just cannot be treated. Also, if you look at the livestock sector, it's going to threaten our food security. That farmer and the work they do can all be unraveled by the problem of antimicrobial resistance. And because it's a One Health issue, the environment is just there in the middle, continuing to push this, continuing to drive that. And through the science, we try to understand how this is moving from one place to the other. But one thing that is clear to us is that regardless of the sector the problem is always caused by human beings. And it is the human beings, you and I, that have to change our behavior. And we have to change our behavior, but we first of all need to even understand that problem for which we need to change behavior. So since 2017, we have been trying as a country to address antimicrobial resistance in an organized manner. And we started by developing our first national action plan that helped us to organize as a country to say we are going to address antimicrobial resistance through different pillars, one of them being the awareness pillar. And there we have all these bright ideas on how we are going to get every Nigerian, the whole of society, whole of sector. Everybody needs to understand this. Everybody needs to engage. But so many years later, the reality is now very clear. And I think DG asks me every day, Tochi, how are you interpreting and using the data? This is one of the ways we are using the data. Because the data did point us to the fact that we use a lot of, AMR is an acronym of English words. And Ayo has just made it clear that even in English, it is the people who English is their local language struggle to understand it, let alone for people is their second language. And it's a reality we came to realize that we have to stop and truly, truly find the right words that we can tell all Nigerians that this is how we can begin to talk about and communicate AMR. While we're waiting for that name to come, we have not stopped. We have been trying to use the words we currently have to express AMR to carry out awareness activities. And that is why I'm very, very happy that we have the AMR InterVarsity Club here. They have been very strong partners. The young people have been very strong partners, and all the civil society organizations here and our One Health stakeholders. But in spite of our best efforts, we have come to realize that our AMR messages are not adapted for local stakeholder groups. We have made efforts to translate some of them into local languages, but in spite of our best efforts, we haven't been able to reach the grassroots, like the farmers, the market women. Our communication in our local languages have really not been what we desire it to be. Everybody has mentioned that I liked the map that the professor showed that Nigeria is really a country with many different languages. Well, we can look at that map and think there's just some random things going on there. But within that map and all the languages people use to express themselves, they carry some things. They carry the worldviews of the people there. They carry the years of wisdom translated down the line from their ancestors and their forefathers. It carries the daily rhythm of their lives. As Africans, we express ourselves in proverbs. We express things that have deep meaning to us through folklore, music, art, dance. Even the sound of a drum can communicate something. That is how originally we live our day-to-day realities. But then, when we come to communicate medical terms such as AMR, we rely on an English acronym, one that has little or no meaning to our people. Imagine the farmer who is herding cattle in the northern part of Nigeria. AMR holds no meaning to him. The market woman who just stops the trader by the side and says, give me mixed medicine for me. AMR as three-word acronym really is not something he can easily relate to. So for us who have to really develop these messages, push the messaging, it means that while we may be technically accurate, we are simply emotionally distant from the people we want to reach. Yet, every day we write our reports, we send it, we say we are doing a whole of society approach, we are doing a whole of society response, when our people cannot say AMR in their own language, meaning that everything we tell them, they might hear, but understanding, discussing it, owning the solution, and that is where that gap that we are using and hoping we'll use SayAMR to fill. So SayAMR is really the beginning of a national dialogue. And we are hoping to bring together Nigeria's brightest minds, the linguists, the scientists, the communicators, the artists, the young people, to come together so that we can co-create culturally grounded expressions for AMR, starting with our major four Nigerian languages, Hausa, Igbo, Yoruba, and Pidgin. And depending on how successful we are, and depending on the appetite for Nigerians to continue to carry this forward, which I suspect this will be so exciting that it will become an ongoing thing, extend it to as many Nigerian languages as we are able to. And this initiative represents the next evolution in our communication strategy as a national AMR program. And because we have a plan that is guiding our national effort, we always like to put it back and show really that this is not something we just came up and just wanted to do. It's part of our plan, and it aligns with our national action plan. And we're trying to get one huge Niger voice where we are harmonized, is centered around the people. It helps to empower our people to change their behavior. And when we finally have these words, how are we going to use it? We will use it by then communicating uniformly. Our media people will have a way, whether their own media is in Igbo, Hausa, Yoruba, Pidgin, they will have a uniform way of saying AMR. Our risk communication team, our community level operators will be a bit more confident in the language they use in telling the people about AMR. It will then make it easier for us to develop targeted messages, the jingles, the radio programs. When we then go into schools and communities to engage with them at that level of intervention, we'll have one more way that we are a bit more comfortable talking to the people. So it will support our early prevention efforts. It will support the health promotion efforts that we make, because we'll be empowering the communities, getting them to participate very, very early at the level of health promotion, rather than waiting for response where they're now sitting in hospitals and all the well-educated experts are talking to them in a 3-letter acronym. And we're hoping that all that will then help us to build a sustained nationwide movement as we tackle antimicrobial resistance. We really have to name it right if we are going to own the fight. Thank you very much.
Please, another round of applause for Dr. Tochi. Oh, cool. While you were speaking, you kind of took me down memory lane, growing up in the southwestern part of Nigeria and listening to the news in the morning and listening to those who cast the news in Yoruba language. And it was an opportunity to learn a lot of words. It was also very interesting and also funny, because you will hear, the exclamations before the headlines. that memory just came back to mind, and I'm looking forward to when we're able to distill all of these technical terms into languages that people can, understand at the grassroots level. Thank you very much, Dr. Tochi. All right, the next thing on the agenda is the presentation of the SayAMR Hackathon brief, and this will be done by the AMR program manager at DRASA, who is none other than Miss Oluwatoni Akinola. Can we please welcome Oluwatoni with a round of applause?
Good afternoon, SayAMR's distinguished dignitaries, esteemed directors of the NCDC, my colleagues at DRASA Health Trust, SICAPS, and also CVCNU, the phenomenal media present, and ladies and gentlemen, especially online, good afternoon. So I'm just going to take us through the SayAMR Hackathon, and I trust that you will get everything that you need from this. Okay, so as has already been rightly said, the hackathon is basically an innovative means of solving the AMR problem. It's a way for us to engage the young people nationwide, put the energy to right use, and develop AMR in Hausa, Igbo, in Pidgin English, and in Yoruba. So why exactly do languages matter? I'll share a quick story. So on our team, last year, to commemorate the World Antimicrobial Resistance Awareness Week, we engaged with the AMR ITP team and with the AMR clubs in universities nationwide, encouraged them and supported them to be able to go into the communities to sensitize people on AMR. And the DRASA team actually went to a market with a university team here in Abuja, and we got to sensitize them on AMR. While we were able to communicate to some people effectively, there were some people that were actually dismissive, like what exactly are you talking about? What's this foreign abstract term? That just shows the need for this to be in a language that people understand. If I could say AMR in Yoruba, I'm sure I could have communicated properly with somebody in the market. That's why it's important. We have over 500 languages in Nigeria. In a particular state, Taraba, there's about 70 languages, just to show how many. So what we hope to achieve, we hope to have standardized AMR terminology in the 4 main languages. We hope to ensure that the youth are very involved in this. It's a youth-driven, innovative exercise in public health communication. And it will allow for greater awareness and inclusion for communities. And then we'll make sure that we have a model that we're able to use for naming public health concepts and diseases in Nigeria. Okay, so a quick overview of the process. There's a call for application that is being launched today, and it will be open for 8 weeks. And it's open to, the eligibility criteria will be shared. Next, we'll have the eligibility screening for 2 weeks where the submissions will be reviewed. And I just encourage all the youth that participate, please follow the eligibility criteria so that you get through to the next round. And then we'll have an initial review with the team that will be scoring this according to a standardized scoring rubric. And following this, there'll be a Delphi process. So there'll be an advisory team that will further review, further score with some questionnaires and some pre-prepared questions to make sure that the submissions align with what we're looking for. After this, for a week, there will be a community pilot where the shortlisted teams will engage with their communities using the terminology that they have developed. They'll go through public voting, social media campaigns, and then the teams with the highest score from this community pilot would advance to the next stage. And after this, we have a debate. So again, the advisory team, the judges, will have the people that have submitted present to them and debate, basically, and justify why their terminologies are the winning ones. Following this, there is a final review and further refinement of the terminologies, because as much as it's a competition, the aim is to have AMR terminologies that we can actually use in communication messaging. So it will be further refined and it will move to the next stage. which is actually the national unveiling. So the winning teams for each language will be celebrated, recognized on the national scale. Okay, so eligibility criteria. The age requirements, so the students that are in these teams should be within the ages of 18 to 35. The team composition is 4 to 8 multidisciplinary undergraduate and postgraduate students, with at least 25% being linguistics majors. So for example, if you have a group of 8, you have 2 people that are linguistics students. And then we have to make sure that your university is accredited and you have at least 1 faculty advisor within your team. Next, faculty endorsement. So the teams must be endorsed by the Vice Chancellor or someone delegated by the Vice Chancellor. And the teams must, regarding translation submission, the teams must submit translations in at least 1 of the 4 approved languages. So Hausa, Igbo, Pidgin English, and Yoruba. Nothing else at the moment. I'm sure we'll progress to that in a future stage, as has been mentioned. So academic affiliation. So both students and faculty participants must belong to the same university department or linguistics department. Next is the submission criteria. So this is incredibly important. And you won't be able to proceed in the application without this. Research is very important, and we don't assume that everyone knows what AMR is, so you're expected to find out more about AMR if you don't already know. We can't assume the linguistic students know about AMR. Make sure that you do this research and then come up with a draft of what AMR is for submission. The next is consultation. So the teams will conduct consultative sessions with public health experts, AMR experts, linguistics experts, their peers, lecturers, community leaders. And this will guide the development of the submissions. So it's not going into a room and just trying to figure it out on your own. It involves consultations. And audio, video, and pictorial evidence of these consultations will be required as well. The next is the community pilot. So after the consultative sessions, the teams are expected to conduct community-based tests for their developed terminologies. So this includes going into markets, for example, and testing these terminologies, recording the feedback, and seeing from whatever community that you go into, what's the feedback, do people understand, and just basically noting this down. And again, audio, video, pictorial evidence of this is required. So just a note, so due to the acknowledgement of the many dialects that we have within each language, we will be ensuring that the focus is on the most popular within the languages. For example, is the Igbo Izugbe dialect for Igbo. Okay. Submission requirements. So this is necessary, and it is on the website. And when we get to that stage, you will see everything there. Proof of enrollment in a linguistics course within an accredited university, proof of faculty, endorsement from a linguistics lecturer or other academic staff as assigned by the VC, national ID, a brief overview of AMR research as has been mentioned, written record of your understanding of AMR, video, audio, pictorial, and written records of the consultative sessions, including a database with contacts, so name, designation, organization, all those are important, of those who were consulted. And then we have, again, video, audio, and pictorial records of the community pilot, and a short video explaining the developed terminology for each language submission, with clearly stated sentences in the languages. Okay, so what are the judges looking for? They're looking for cultural relevance. They're looking for memorability, accuracy, simplicity, and public acceptance. All right, and I'll close on this note, just sharing the timeline. So this is 10th October, the launch, and until December 5th, applications will be open. So please do well to get into the teams that you need to form. Check the website when it is launched later in this event. You will see that. And make sure that you do everything you need to do within the deadline. Eligibility screening happens after that, the initial review, the Delphi process, cutting into the next year. February, there will be the community pilot, the debate, and the final review between end of February and March. And then mid-March to April will be the national unveiling. So I will close on this note. We trust everything is clear, and all the best and good luck. Thank you.
Thank you very much to the DRASA team for that very elaborate process map. All right, so we have come to an interesting part of today's agenda. Interesting because we will be taking an AMR survival story up next. But while we get the video ready, I'd like to say that when we talk about antimicrobial resistance, and it can sound abstract, even distant. But when you hear the story of a farmer who lost his livestock because antibiotics stopped working, or as Dr. Tochi shared, the surgery goes sideways, or a mother whose child could not recover from a simple infection, then it stops being theory. It becomes real. And that's the power of human interest stories. They translate science into emotion. They remind us that AMR is not just a hospital issue, it's a community issue, it's a household issue, and it's a language issue. And in Nigeria, we all know that information doesn't travel through journals or policy papers alone. It travels through people. True stories told in churches, markets, schools. That's where awareness truly spreads. So when we share these stories, we're not just informing minds. We're shaping how people see health, how they act, and how they protect their families. The person whose story we'll be sharing today is a member of the WHO Task Force for AMR survivors. And his name is pharmacist Mashood Lawal. He's one of Nigeria's leading voices in antimicrobial stewardship and public health advocacy. And as an AMR survivor, his personal experience with drug-resistant infection fuels his passion for raising awareness about the dangers of antimicrobial resistance and the importance of responsible antibiotic use. He has a background spanning clinical and public health pharmacy. Pharmacist Lawal has spearheaded multiple initiatives that empower healthcare professionals and communities to adopt safer, evidence-based practices. And his lived experience, combined with his professional expertise, makes him a powerful advocate and storyteller in Nigeria's fight against AMR. All right, so do we have the video ready?
My name is Mashood Olukulawa. I'm a pharmacist by training.
Okay, great.
I'm in Nigeria.
Can I get some help?
I am a survivor. That is antimicrobial resistance survivor. I'm also a member of the WHO Task Force of AMR survivors. So my AMR story started sometimes in 2020 when I developed kidney stone. After the whole procedure, the follow-up procedure, which involves the removal of a stent, a tiny tube placed within my kidney and bladder to remove the water that had gathered in my kidney as a result of the blockade by the stone, got infected, and that process took place on a Saturday. By Monday of that very the next 48 hours, after the feeling feverish, and when I thought it was malaria, I treated it, but the symptoms persisted. I'm also a member of the WHO Task Force of AMR survivors. My AMR story started Sometimes in 2020, when I developed kidney stone, the whole procedure, the follow-up procedure, which involves the removal of the stent, it's starting to place between, which I did. I was on the second packet when the issue came up again, when I thought I was all right. He now advised me to come to the laboratory. We did a test, and it shows that a urine test, that it was a urinary tract infection of heavy growth of Escherichia coli, sensitive to another antibiotic, which I took, and I was on the second package again. That is about 10 or 8 days of treatment. The symptoms came back. And at this point, I had to go for another test because of a dream I had. I went for COVID-19 test, and it became positive. So I contracted COVID-19 while I was still battling with the AMR. I was admitted, I was in the isolation ward for weeks. Some of this, I was on oxygen. When I was there, I also tested my urine, and it turned out to be the same Escherichia coli, no change, heavy growth, sensitive to another antibiotics, which I took. I was placed on the injection intravenously into my vein. Later on, I took the tablets for about 5 weeks. The symptom persisted, and the people at the isolation center had to discharge me. That I was free of COVID-19. I should go back to my consultant for the treatment of my AMR. I went back with him. We did another series of tests, and it was now sensitive to another antibiotic, which, thank God, and to the grace of science and God, it became very effective, and I got out of it. The experience was tough, life-threatening, such that I could not even attend the burial or the 8th prayer of my mother. That was the experience. AMR is a global threat to Earth. It is not unreal. It is real. AMR involves people's life, mothers, fathers, children, all the people we know around us could be victims of AMR. I want to commend the group that are doing this program for coming up with this. And I want to urge everyone that is participating on this program to consider it a privilege, an opportunity for them to contribute to the betterment of humanity. I want you to do all this job well, and I want to advise my professional colleagues, pharmacists, medical doctors, nurses, and others, that we need to avoid the generality of the public that we must use antimicrobials, not only antibiotics. The rate at which we abuse antifungals in Nigeria is alarming. In the farm, in the fishery, in the animal husbandry, we need to be very responsible to safeguard humanity. If we do not take care, we stand the risk of losing all the gains that we have attained with the advent of antimicrobials. Once again, I thank you all, and I wish you a very successful program. Thank you. Thank you. My name is Mashut Olukulawa. I'm a pharmacist by training. I'm in Nigeria. I'm a survivor. That is antimicrobial resistance survivor. I'm also a member of the WHO task force of AMR survivors. So my AMR story started.
All right. Thank you very much. And that was the story of pharmacist Mashood Lawal. And we're glad that he gets to share his story with us. And I hope that we also get to see many more stories, because stories are critical in pushing the narrative and the awareness that we want concerning AMR. All right, so we have gotten to the meat of why we're here present, and we're about to launch the hackathon. So I'll just ask, all those who want to record the moment, you can come and position your cameras. We're going to launch it together. What we're going to do is we're going to count down from 5 to 1, and when we count down, then we go live. So what's going to happen is you can use your phone to scan the QR code and begin to engage in the process. Are we ready? We don't look like we are ready. Are we ready? I'm expecting that we will be excited, energized, anticipate this moment. This is a monumental time in the history of public health in Nigeria, because even though we're in a small room, this is a very big moment. This is something that will define the landscape for years to come. So what you are doing is you are participating in a critical moment in Nigeria's history. Are we together now? Are you excited? Are you excited about that? All right, so we're going to count down 5, 4, 3, 2, 1, and then when it comes live, I want to hear the biggest round of applause. Are we together now? We are planning this. When we look back at the time this hackathon was launched, I want you to feel the excitement that I was in the room when this thing happened. Are we together now? All right, great. So can we count down together? 1, 2, go. 5, 4, 3, 2, 1. The hackathon is officially launched. Please, your hands together, everybody. Clap, 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 clap. Yeah. All right, so this is the moment in history. This is that moment. So you can use your phone, scan the QR code, and you can see the steps to take. Check your eligibility, prepare submission, complete application. When you have the link, please send to, I know that the people in the older generation, they are very good at sending WhatsApp broadcast messages to their children. This is another opportunity to, use that WhatsApp broadcast tool for the good of the nation. So forward it to them, to your children in school, forward it to your cousins, your nieces, and, encourage them to get involved in this. Please scan, use your phone and scan it. I'll give you that time. Someone said I should tell you, if your phone cannot scan it, then you have to change your phone. And for media colleagues present here, I think we can also equally get a very zoomed in video image of this QR code, and people can easily scan it from their TVs also too. Scan. We are gradually coming to the end of this very important event. The next thing is session. Okay. So before we take the Q&A session, are we done scanning the links? All right. So before we go into Q&A session, we would like to take a group picture. Please. Great. So we have some people stand up and some people stand on the stair. So, Director, don't you think we should take questions before the pictures? Because, yeah, so maybe, okay. So in case we have a question. Okay, so Please hold on. Before the pictures, we want to quickly take a few questions and then we can take group pictures and go. So, do we have any questions? I have to second microphone. All right, we have questions. All right, so question first.
The core protocols observed. I like to join my voice to appreciate Grasa and all the distinguished leaders on this move. I just have a comment. When Nini was presenting earlier on, and from what we've heard so far, it seems this is more to the colleagues in the university, if I'm right. And I'm trying to ask Prof. I'm sure Prof will know about the Nigerian Institute of Translators, and you're part of it. I'm aware they're going to even have their conference in November. I feel it would be a good opportunity to extend this beyond the university circle to that group to give us a wider opportunity to contribute into this discussion. Their website is nitnigeria.com, where we can really reach out to them if it is acceptable by the group. That's just my comment. Thank you very much.
You see, at the beginning, I'm a linguist. And for me, this creates even job for my students. Are you getting the point? So you are not just doing something for fun. As you treat health, you provide health care. Again, it provides jobs to our students in the Department of Languages and Linguistics, those in translation, and again, about collaboration. So as a matter of fact, I am the great beneficiary. Thank you.
Good morning. My name is Yechenu Sasetu. I'm the health editor for Montage Radio. So I don't know if I missed it during the presentation, but I didn't see anything about maybe a grand prize. What are the incentives? Because beyond people talking about AMR, we know that somehow when there are incentives, it pushes for better participation.
What's the price?
We want to know what is the price. So as you will see on the website, which you can get from the QR code, there's a cash prize. But beyond the cash prize, we want people to understand that what we are doing is getting national consensus on these words. So the words that are used are going to be taken into everything we're doing for AMR awareness nationwide. So you get the privilege of being the one to be able to say, me and my team members were the ones that contributed this. In addition, I hope we're all aware that Nigeria is hosting the next high-level meeting on AMR next year, 2026. It's like the Olympics of AMR for the whole world. It's the first time an African country has been honored to host it, and it's going to be here in Nigeria. As part of that, we're also looking at ways to showcase youth and innovation. This is going to be part of that. So there's many opportunities for you to not just get money, but also be on a global stage and to be seen as somebody who contributed to a very big problem that we have here in Nigeria and across the world.
Thank you. Okay, Mr. Richard. After, can you please come forward? Yes.
Good afternoon, everybody. My name is Rachel Abuja from News Agency of Nigeria. Professor, good afternoon, sir. Doing health and journalism, which is big. And I believe coming back to Nigeria from France, I was hoping I'll get a big job with foreign affairs or any international company. Yes, I got with Belgian embassy. But at the end of the day, I left and I found somewhere else. Now, this leads to my question for you, sir. You highlighted the importance of language and culture, identity in science and communication. So how can Nigerian university practically integrate indigenous language into health and science education to make research and innovation more accessible to communities, because that's what we see when we go to speak to people in the community. They find it very difficult to even we don't understand ourselves. And at the end of the day, a disease like HIV, in Hausa, they call it kanjemu. They have to form this name themselves. So we would like to know what you'll be doing from here, because I just went through your profile and I saw that you're very big in that area, in that community. So we know, let's just know what you do after here. My next question is for Dr. Tochi. Thank you very much for all that you do, ma'am. NCDC has been in the forefront, and we know what you do. And as Nigerians continue to respond to AMR, how do you see initiative like the AMR language program today, strengthening community level awareness and supporting NCDC broader AMR awareness strategy that we have in place today? Even though you said you just brushed some part, but we just want to go deep so that by next day I'll be holding you accountable. For Dasra, thank you for this beautiful initiative. So this initiative is creatively, let's say, a blend of science and language. In fact, I had to ask your program manager that this is huge, that I don't know what led to it, but it's big. And if we can actually make it work, it's going to, we use that for Lassa fever, for a whole lot of outbreaks that we face in this side of the world. So, language culture to communicate AMR, as you said. What long-term impact do you envisage from here today? And how do you plan to sustain youth engagement and community participation beyond this event? Because I know what you do. We have AMR week just coming, I think in November, right? So how do we work towards ensuring that when I join you to any community, we won't have the back and forth we usually have and use our hands to tell people you have to wash your hand? How do we hope to communicate better starting from November this year? Thank you.
So I think we'll just answer in the order the questions came. So,
well, you see, the critical thing is, without health, without good health, I think the nation is impoverished. So, language, critically, from our own side, your question is, we will definitely make sure that we reorient our own students to see the beauty in passing information. What most graduates think of when they get a degree, they monetize everything. You see, I taught for many years in Europe, and I was teaching African languages and culture. Many of my former students were diplomats here because I tried to teach them how they could communicate, particularly for those who are applying for visa. We have Julius Berger as a company. We tried also to teach them how they could communicate to our Nigerian people to be able to understand how they could even operate here. Today we have many Chinese companies. Now, Chinese government has provided funding to many universities, and we have Confucius Institute. You know why? Because there is power in language. You don't need to wait for somebody to translate because you could be misunderstood. Now it is giving our students jobs. It is also bringing us together, and we are communicating well. Now, even the science which we have today, if you don't have it in your own local languages, you may not be able to do well. Lastly, on Sunday, this coming Sunday, I don't want to just beat my drums. I'll be traveling to Moscow because we sent students here to study Russian language. Why? We want to penetrate into the language of science in the certain things they did them. And all what I ask the pharmacist, anyone who comes and buys this drug, please include just 50 kobo as an amount, you know, because he or she will go with a powerful tool he can read and understand the prescription given to him. And for each person who comes to that clinic, you say, I'm sitting in my office in the university, I was earning 50 kobo. And the multiple of that gave me money more than my monthly salary. And then I can see that my sisters, my brothers in the community are able to follow these prescriptions without waiting for anybody to tell them. So we go right down up to that level. This is the way I can simply put it. But please avoid making things too high. Okay? If you localize, this is where it goes. Today we use English. How many children speak English at the football field? How many? So as a matter of fact, if you go to your village as a student, as a university graduate, you are jobless. But the one who did small things are the ones who are reaching out to the community. That's why many graduates don't have jobs. But those with diplomas in polytechnics, they can do in research, recharge card, fixing bulbs, and they're having money. The one with the big grammar is moving around asking for pocket money. So this program, we are going right down. That's why I say you are giving job to my students. Are you getting it? If there is a linguist in the community, I will link him up to the pharmacist. He should translate that in that only that village, and they will get some money. Thank you.
Thank you, Rachel. But DJ, I suspect you may want to speak to what is your passion, what to do with the youth. I'm happy I live up to who I am. No, please, set the tone, sir, please, because it's your passion. I can't do justice to it the way you will, then I can add up. Okay. So if you check DG's phone, you will see a lot of messages in it, and it contains even a full list of the youth groups in this country that we have, because it's clearly a strategic decision that he's leading. The problem, when you look at some of the data about the impact AMR will have, like by 2015, by 2030, it's a problem of the people in the future, really, even though it's already happening now. But if action is not taken, the future is very, very bleak for the young people. And that is why also in that understanding that we have to be participatory and really bring in the people whose problem it truly is into the picture is why there's a prioritization of the youth. We have a huge youth population that are highly innovative. They have both the use of technology. So they're really being prioritized. We have been working with them, but there's now even a bigger push to engage them in a much more strategic form. And something like this, SayAMR, is part of it. And Rachel, you asked specifically how we intend to use them for the World Antimicrobial Awareness Week. That part of our planning, at least the Nigerian Medical Students Association they're planning World Antimicrobial Awareness Week with us, and the whole list of the youth that we have, the different youth clubs that we have. We also, in fact, by early next week, we are going to engage with them just to unfold the World Antimicrobial Awareness Week activities. And then they can own it. It's not to dictate it to them, but it's just to find a way to collaborate. But it's just the starting. There's really a clear strategic plan to engage with them. I'll hand over to DG now to speak to it.
Yes. I think I said that if you look at the economy, the youth demographic, anyway, demography in the country, the youth constituted about 60% of its population. Let's look at it. So if we do not engage them, I think it's a waste of time. That's number one. Number two, I belong to a club in Lagos, the boat club. And every Friday evening you go there, you see old. And as a particular arrangement, there's one particular one side That's the last bus stop. And that's a fixed number of people, members. You can't get new members unless somebody dies. So a friend of mine is a cardiologist. He said he wanted to be a member. I said, try and kill one of those people. Maybe crazy. But that's the joke. But the youth, they've been coming, they enjoy the club, and they plan a coup. They organizing the election. They make sure that their people were elected. Now they've changed the culture of the Labour's Boat Club. It's more vibrant, but again, they relegated some of us to the background. This reporter came in just now. He said, what's my number? And I opened my book, I wrote the number there and name. He said, you're old-fashioned, do I say yes? But the last bit, 2 weeks ago, okay, a month ago, a student has been harassing me, calling me represents the president of a particular youth, whatever it is. They wanted to come and pay a visit. I couldn't give an answer, but they were very persistent. The one Sunday, he just called me. I said, okay, come tomorrow. I was taken aback. But they came that day and had an interesting meeting with them. Out of their own volition, they came up with this program on Lassa fever. That public health awareness, advisory, whatever it is, they wanted to participate. And they are not asking for money. All they wanted is to partner with NCDC, whatever it is. And I sat down and looked at them. And I started asking each one of them the question. Most of them are public health students, and 4 of them were in Abuja here. And I said to them, we're not limited to Lassa fever. We're limited to every single advocacy we want to do in NCDC, including AMR. Why I'm saying this is that these guys need to be empowered. Without knowledge, there isn't much, but they have that capacity, they have that strength, they have the movement, they can reach where most of us cannot reach. And we'll be stupid as a government not to engage them. So I'm happy that everybody is looking at youth. The last bit, yes, we are hosting the high-level ministerial conference in Nigeria next year. And one of the things, initiative we're going to follow and forward is one to showcase what Africa is doing, what Nigeria is doing on AMR. And there's supposed to be 5 initiatives that have been collapsed into 3. One of them is youth, IPC, and WASH. The idea is to use the strength of our youth to generate awareness on AMR. And I believe what we are doing today, if I started writing down, would have thought I was taking lecture notes. No, my head was working. I was trying to write down again, how now do we fashion all this into making a presentation next year? This is time to start. I sat with my colleague, a linguist. This is the first time I'm sitting next to somebody like that. I don't understand what they do. But it showed that map, first one. I said, can you forward it to me? Because my head, something clicked in my head, which we are going to use. But the point is that the engagement of our youth with NCDC, in public health, in health advocacy, we are going to accelerate, fast track. This is where Tochi and I always at loggerheads. All I kept telling you guys are too slow, you blow too much grammar, you're in university. Look, I'm in a hurry. But I understand what you've said, what we've done, but I'm going to amend it. We're going to fast track this process because you say the youth are our future in this country. Thank you. I hope I've answered your question. Youth should clap for you more.
Yeah, so I think we'll just take one more question here, so that I sense that the owner of this facility wants us to leave on time, so they've turned off the AC. So we'll just take one question and then.
Yeah, mine is not really a question per se. I want to make some kind of remark. I work with this newspaper, so Nyebuchi Ezigbo is my name. I am tempted to link what AMR is to when we had the outbreak of AIDS, I don't know, and that language, acquired immune deficiency syndrome, was also a challenging issue, how to communicate that to Nigerians. But at the end of the day, I think we were able to get that term easily passed around. And Nigerian, every language now has what they call it. So can we also adopt that same strategy, the method that was used in getting the message of AIDS around the country to also propagate this AMR? If we look at it, every language in Igbo, they call it one name. In Yoruba, they call it one name. In Hausa, they call it one name. And everybody got to know about it. So that is just one. The second thing, I didn't know, maybe for the purposes of publicity, awareness, creation, that you chose to use your eligibility for an academic exercise while you restricted it to students. The issue of language and linguistics, somehow you can also not remove it from the society. Those who are culturally inclined, there are people who know this language better, even though they have never entered the walls of the university or academic institution, but they can generate ideas about it. So if you want to really have urgency in generating thoughts about how to describe AMR, I do not think we should make it extremely an academic exercise. You should also quickly get people, throw it open so that you can get a term that you can use to do this campaign. Thank you.
Thank you very much for that quality contribution. Are we able to take one more question? No. Okay.
Thank you very much for your questions. I will let Dr. Tochi respond to the first and then we'll go.
Thank you. I'll respond to the gentleman from this day. So this has actually taken 1 year in the making, and I acknowledge that it's something that the whole society, we need to get into the community. It takes that spectrum. But why we wanted to start with the linguist is that we understand that some sort of engineering of language, permit the use of that word. We want to make sure that methodologically and as per protocol, that we have a sound basis for arriving at it. And we want the experts to be the beginning. And that's why we said the students, the faculty who will be guiding them, and not only the linguists, but other students, that's the starting point. But if you look at the process, they will first of all go and even get a good understanding of AMR. They just can't assume that they understand. They get a good understanding of AMR. And then when they come up with the ideas, when they engineer the language and create that language, they will then go into communities to ask people, and that is where the point you raised now. They will need to prove that they did work with people to say that, oh, this language works for us. This language is what we recognize. So it's a whole spectrum, and what you mentioned is a part of it. Thank you.
Okay, I think it's been answered. Are we able to take any other question? All right, so I guess we're pressed for time, and we'll have to bring this meeting to an end. Can we put our hands together for ourselves, for staying this long and for being part of this very important activity? All right, so can we come out for a group picture? And that's how we close out. All right, so let the creative people give us a direction. I figure some of us will stand on the podium, some people stand. Yes, sir. Yes, let me see if you can. That's the seat. All right. 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 So we'll have the DJ, Prof, Dr. Tochi, basically all of the high table stand and then we'll flank them. And and directors, yes. Please, to the center, sir. Here, sir. Well done, sir. I think this is center, right? Okay, so you want to come forward. Thank you, sir. Okay, so we'll first have the picture with the group picture for the hold on. Dr. Tochi, I think you should come to this side. Yeah, so no, they want to have a group picture first. Then. Okay, then we'll have with partners. Okay. Thank you. So just let me know when you get the full picture. All right, can we have the partners join them too? Can we have the partners join them? All the directors. Okay. It's just for the photo ops. Okay. Yes, sir. Okay, Mike, say you can join them. Yes, sir. Are we good? Can we have the directors join them? Thank you. If you can stand, if there's space, you can stand down. Are we good? All right. Please don't go yet. Let's everybody join. Everyone present, please. Everybody join. The Drasa team, everybody present. Quickly. Everyone here present, yeah. To show that you are a part of this important moment in Nigeria's history. Quickly. Don't worry, the stage can hold your weight.
Glory to God.